Ladies and gentlemen, distinguished guests, good disability policy benefits all Australians now and in the future. On behalf of the Centre of Research Excellence in Disability and Health and the Australian Human Rights Commission, I'd like to welcome you to our webinar for the National Disability Strategy Beyond 2020. My name is Ben Gauntlett and I'm the Disability Discrimination Commissioner at the Australian Human Rights Commission. I will be facilitating the panels today. I'll be making brief introductory remarks explaining the program shortly. But before that, I'd like to invite Mr. Damian Griffis of First Peoples Disability Network to do an acknowledgement of country.
Thanks, Ben. I'd like to acknowledge the traditional owners on whose land we are gathered on today. I'm speaking to you from Awabakal and Worimi country. I know we have people on the line from Gadigal country, Wurundjeri country, Ngambri and Ngunnawal country, Larrakia, Kavanagh country and Noongar country, just to name a few. I'd like to acknowledge elders past, present and emerging and take the opportunity to make special acknowledgement of two of our founding elders, Uncle Lester Bostock and Auntie Gail Rankin, who we lost recently. Thank you, Ben.
Thank you, Damian, and thank you to everyone who has joined for today's discussion. I'd like to also acknowledge the traditional owners of the land on which we meet today and pay my respect to elders past and present. We have more than 800 registered attendees, which is an excellent turnout. Our event today has three objectives. First, to encourage people to make submissions on the National Disability Strategy position paper, July 2020. Second, to promote the importance of research, evidence and data when formulating disability policy. Third, to encourage all members of the community to take an interest in the broad range of policies affecting people with disability now and in the future. Not just the 4.4 million Australians who presently have a disability, not just the people with disability and their families and support networks, everyone. As the National Human Rights Institution, the Australian Human Rights Commission is deeply interested to ensure we have a national disability strategy that is reflective of human rights considerations and acknowledges our community values of diversity and inclusion. To properly do this, we need all levels of government to be aware of the importance of objective evidence, data, and accessible information for people with disability. Therefore, we are holding this event jointly with the Centre of Research Excellence in Disability and Health, which is a cross-university collaboration that aims to gather the evidence needed to guide social and health policy reform for people with disability in Australia. We have sought to keep our panels and intervening videos short and with a lot of presenters to ensure a variety of views. Today, our first panel will look at what the previous National Disability Strategy will remember for and whether we should adopt a similar approach in the future. Our second panel will consider what is the role of national disability strategies in Australia and overseas. Finally, our third panel will look at specific issues under the National Disability Strategy. 10 years ago, when all levels of government were considering a national disability strategy following the shutout report, the issues were different, but the underlying concern of the rights, opportunity and well-being of people with disability was the same. The Convention on the Rights of Persons with Disabilities had just been signed and ratified by Australia. The National Disability Insurance Scheme was about to commence, and questions existed whether our laws protecting the human rights of people with disability were fit for purpose. 10 years later, a considerable amount of effort has gone into reviewing the previous strategy and consulting as to the new strategy. This has led to the development of a position paper, which seeks to consider the good aspects of the previous strategy and learn from some of the challenges faced. The position paper seeks to follow, with minor amendment, the previous National Disability Strategy's approach concerning its vision and outcome areas. The vision suggested is an inclusive Australian society that enables people with disability to fulfil their potential as equal members of the community. And the outcome areas being first, economic security, second, inclusive and accessible communities, third, rights, protection, justice and legislation, fourth, personal and community support, fifth, learning and skills, and finally, health and wellbeing. However, the position paper also seeks to make improvements in the new strategy by relying upon guiding principles, an increased focus on community attitudes, strengthening accountability by clearly describing roles and responsibilities of government, monitoring outcomes and reporting, better promoting and communicating the strategy through targeted action plans and an engagement plan, and focusing upon workforce development. I acknowledge it is a stressful time for people with disability in Australia. The COVID-19 pandemic has caused understandable unrest, with many people with disability questioning how they are perceived in society. There are also significant concerns with reforms in the National Disability Insurance Scheme and the issues raised by the role of people with disability interacting with the Disability Royal Commission. But the strategy is, in a sense, a critical piece of infrastructure upon which other policies build off. We need to get it right, and we need people with disability to be central to its implementation and assessment for the next decade. Please constructively comment. I hope today encourages you to do so. Our first panel will be a reflection on the last National Disability Strategy. And as was mentioned in the introduction, we have a series of short videos which will be playing where people will provide comment on to inform the panel's views on certain issues. We've asked the much admired campaign director, Kirsten Dean of Every Australian Counts, to answer the question, what will the last National Disability Strategy be remembered for?
I have to admit that I have mixed feelings when I look back on Shut Out and the very first National Disability Strategy. On the one hand, it was the first time that governments all around Australia came together and articulated a vision for people with disability in this country and promised to do their bit to help make that vision happen. On the other hand, I'm really struck when I reread both those documents of how far we still have to go. Many people with disability in this country still experience the kinds of discrimination and barriers that are described in those pages. And the gap in life outcomes between people with disability and those without disability is still too large. I really hope this next National Disability Strategy starts to change that picture.
Thank you for that video. I'll then now move to introduce our first panel, which will be reflecting on the last National Disability Strategy. As previously articulated, the position paper seeks to adopt certain aspects of the last National Disability Strategy, but also seeks to make improvements on the new strategy by relying on guiding principles, an increased focus on community attitudes, strengthening accountability, including by clearly describing the roles and responsibilities of government, articulating clear monitoring outcomes and the need for better reporting, better promoting and communicating the strategy through such things as targeted action and an engagement plan, and focusing upon workforce development. Our panellists for this session are Professor Gwyneth Llewellyn, who is a co-director of the Centre of Research Excellence in Disability and Health and director at the Centre of Disability Research and Policy at the University of Sydney. Gwyneth is also the head of the WHO Collaborating Centre in Health Workforce Development in Rehabilitation and Long-Term Care. Her research focuses upon developing health and social policy and practice solutions to enable disabled individuals and their families to fully participate in society. Our second panellist is Commissioner Robert Fitzgerald, who was New South Wales' first Ageing and Disability Commissioner, which is tasked with protecting adults with disability and older people. Commissioner Fitzgerald served on the Royal Commission into Institutional Responses to Child Sexual Abuse from 2013 to 2017. He also spent time as Productivity Commissioner and Community and Disability Services Commissioner. As Productivity Commissioner, Commissioner Fitzgerald reviewed the National Disability Agreement, which was entered into in 2009 by state and territory government to promote cooperation, enhance accountability, and clarify roles and responsibilities of government. And our final panellist for this session is Professor Karen Fisher, who is a professor at the UNSW Social Policy Research Centre. Her research interests are the organisation of social services in Australia and China, disability and mental health policy, inclusive research and evaluation, and social policy processes. Professor Fisher was involved in the review of the National Disability Strategy in 2019 for the UNSW Social Policy Research Centre. If I might then ask the panellists to make themselves available. Gwyneth, I might start with you. Thank you for attending today. The vision and outcome areas suggested in the position paper are very similar to the previous National Disability Strategy. What are your views on adopting a similar approach in the next National Disability Strategy?
Thank you, Ben. And I'm speaking from the mid-north coast of New South Wales on Biripa country, and I pay my respects to elders past, present and emerging. To answer your question, the NDS brought Australia into a new way of thinking about people with disability. People with disability in their lives were foregrounded, no longer in the back seat, or indeed invisible. For the first time, a positive vision aimed at fulfilling life-affirming outcomes. The human rights imperative broadcast far and wide that Australia was now committed to the rights of people with disability. The social imperative made it crystal clear that excluding people with disability from mainstream Australian society was no longer acceptable. And the economic imperative demonstrated that Australian discourse about disability and people with disability had to change. It would be in everyone's interest for people with disability to be active participants in the Australian economy. The vision and the outcomes built on those three imperatives, and they remain relevant today. And this is because 10 years on, although some progress has been made, this has been slow. At the CRE, our research on disadvantage and inequality for people with disability demonstrates little progress in many areas of the strategy. For example, inequality in labour force participation by people with disability over the last decade has not been reduced. People with disability are much more likely to experience violence and much less likely to feel safe in their own neighbourhoods. The previous strategy relied on governments, big business and the community all getting on board. But to get on board means you first have to know the strategy exists. And the 2019 consultation round to help shape this new strategy found that less than half of the participants knew about the existence of a national disability strategy. Without robust mechanisms to measure the strategy's aims, it's not possible to monitor if progress is being made, or if not, what are the roadblocks? Evidence is needed to realign policies and initiate new actions, to broadcast good news and to reward effort. Hard labour is also needed, because it takes hard labour to bring about strategic, societal and behavioural change. Constancy and commitment to the NDS vision and outcome areas is a solid beginning. My view is that changing course midstream on the building blocks of the NDS would seriously rock and potentially capsize the momentum already underway. Thanks, Ben, for the opportunity to speak.
Thank you very much, Gwyneth, for those insightful comments. And I note your position of not wanting to rock the boat. I might then ask Robert Fitzgerald for his views. Robert, the vision and outcome areas suggested in the position paper are very similar to the previous National Disability Strategy, which you reviewed in your role as Productivity Commissioner. What are your views on adopting a similar approach in the next National Disability Strategy?
Thanks, Ben. And it's a joy to be with you and Gwyneth and Karen and others today. I was thinking about this morning, and there's a book that was written by Charles Dickens nearly 160 years ago called Great Expectations. And in that book, Pip would have expected a better life. And in a sense, I think that reflects the strategy that's coming to an end. It is a document that is roundly across the nation supported by people with disability and most of those that have been associated in that space. And really, I think Karen will show that in her consultations that didn't change. But what was very clear, and the Productivity Commission's review of the National Disability Agreement showed it, whatever the objectives or outcomes you settle upon, they will have almost no effect unless there is a rigorous oversight of the implementation of the next strategy. There is a very substantial effort to have a good quality outcomes framework. That framework is in fact agreed by the states and territory, but administered by a body like the Productivity Commission, and that there is some oversight by groups such as the Human Rights Commission. Otherwise, 10 years from now, whatever the outcomes or vision that is elected or selected will in fact have failed. Because the way in which governments and all of us operate is that we need a number of different levers or efforts to make it work. The second thing is that in this new role that I've got, one of our statutory functions is to review the performance of the New South Wales government in relation to the implementation of its obligations under the National Disability Strategy. And tomorrow we release a position paper about that role. And I think a couple of things in the outcome areas that I would just highlight in relation to that. The first thing, the outcome areas, I think the 6 are fine, but I'll add one in a moment, is that we need to absolutely acknowledge the issue of safeguarding of people with disability. We have to name and call out the issues of abuse, neglect and exploitation. We have to name and call out how we're going to prevent it, how we're going to moderate it, and how we're going to respond to it. And if we look at the Royal Commissions, both ageing and disability, if we look at the follow-up from the death of Anne-Marie Smith and others, they're all crying out for that, an acknowledgement that not only does the service system need improving, but as a community, we have to be aware of these issues. The second but related issue, and the Productivity Commission recommended this, was a specific area in relation to family and carers. Now, I'm fully aware that some in the disability sector does not support that. But the hard reality is unless we acknowledge their role and support them, then in fact the level of abuse and neglect will continue to rise. The vast majority of abuse within this space occurs by parents, by siblings, by carers. And so in a sense, I think we need to strengthen that either as a separate outcome or part of it. The third is we absolutely have to get right the whole issue about housing, access to it, the safety of it, the affordability, and God knows the design of it. How long have we talked about proper design of housing for people with disability as part of the common way in which we approach these issues? So I think there are strengths in the current framework, just as Gwyneth indicated. And certainly that's been the experience both in the Royal Commission, in relation to the Productivity Commission, but also recently. But I would just go back to the vision. I noticed that the proposal in the position paper is that we remove the word citizens. One of the learnings out of COVID, and there's 3 major ones, is we've restored the notion of humanity. Humans matter. The second thing is we've restored the notion of citizenship. We matter as citizens, not as consumers, not simply as users of services, but suddenly governments treat us as citizens. And I think the vision statement should have that. The third one, and it is in the document, is about community engagement. We now realise just how important community inclusion and engagement really is. And that's a strength that was in the former strategy, but needs to be further elevated in the new strategy. But the question is, how do we do that? We've lost, in a sense, the capacity to mobilise the community as part of the solutions to our problems. We have to re-engage in that in a very effective way. So my final comments is, I think the strategy or the foundations, as Gwyneth said, are sound. They do need quigging, but most importantly, they need to sit within a much stronger framework of design, co-design with people with disability, implementation, oversight, and a very robust outcome framework, which is reported on publicly in a very timely way. And one of the things the last strategy has suffered from is the lack of timely public reporting and, more importantly, the evaluation of initiatives. So they're just some opening thoughts, Ben.
Thank you very much, Robert, for those insightful comments. I may come back to you on the issue of housing when we get to consider what are some of the key issues going forward relating to the National Disability Strategy. But Karen, if I might go to you then, the vision and outcome areas suggested in the position paper are very similar to the previous National Disability Strategy, as has been commented upon. You've previously reviewed the National Disability Strategy, your role at the University of New South Wales. What are your views on adopting a similar approach in the next National Disability Strategy?
I think the answer to that has already been answered. It sounds like it's a good idea. Certainly, we know historically the reason that those outcomes were formed were they were the priorities that came out of the engagement with people with disability across Australia from the Shutout Report, and they're consistent with priorities in the UN Convention on the Rights of People with Disability. The reason for those priorities is that they are the ones that resonate with people with what they want in their lives. We were asked 2 years ago by the government to review the way the current strategy was implemented. And virtually everyone, people with disability and governments, agreed with the outcomes themselves. There were some cross-cutting gaps, and those were particularly around gender equality and participation. But no one said that we need more outcomes. What they emphasised was that we need to change that we are implementing those outcomes and thinking across outcomes. So they gave examples of policy initiatives such as the standards, bringing in universal design, and making sure that we actually implement those types of policies and enforce them. But that way that we can actually address questions of housing and transport and digital information, ones that aren't specifically referred to in the outcomes, but obviously are very core to them. The other big finding in that review was that people were very disappointed with the way that the outcomes had been implemented. It hadn't really made a big difference to people's lives. The goals weren't achieved. But again, they were quite clear about what we need to do to make that part better too. It's really about inclusive policy involvement of people with disability. And I think that means clear responsibility centrally from our governments, but most importantly, locally. So in local communities, people can become involved. They can then have a voice about what their priorities are and how the money can be spent to make a difference that they can see, the action that they need so their lives actually improve now. We can't expect them to wait around for another 10 years to go, oh, that didn't work, did it? I think the other advantage of looking at that central through to local is that that gives us the opportunity to really address the big gaps around diversity. So particularly for people in regional and rural communities and intersectional groups and people who don't and won't ever use an NDIS package. The first plan, really, that was one of the major achievements, but 90% of people with disability will not get a plan. They rely on the other parts of the National Disability Strategy. And so one of the achievements, I think, of that first strategy was the Disability Inclusion Planning Guide that was developed for local governments. It's a way for us to be able to actually articulate how people can be involved. And I think that's a key for the next strategy. Thank you.
Thank you very much, Karen. I might then for the next 11 minutes try and throw open the discussion in relation to relating back some of the answers we've had under Mentimeter to what the panellists have said and what their views are on the three things they think the next National Disability Strategy needs to focus on or achieve in the next 10 years. I noticed when looking at the Mentimeter, we've had employment, community attitudes, inclusion, and housing are all critical concepts there. I might go to you, Robert, because you mentioned the issue of housing. What three issues do you think are important for the National Disability Strategy in the future? I think you're on mute, Robert.
If we just take housing, let me just underlay what I said before. The National Housing Agreement, which was signed up 18 months ago, 2 years ago, notwithstanding the National Disability Agreement, notwithstanding the National Strategy, did not mention people with disability. Now that's extraordinary. That's astonishing that 9 governments of Australia committed to a National Disability Agreement, although much weakened at the present time, didn't even have it in. And yet it's central to the strategy. So the question about housing, accessible housing, affordable housing, housing that is appropriately designed for people with disability, is now a critical issue as we see the increasing level of disability associated with ageing. I mean, this is a huge issue for an ageing population, yet alone for people that have had disability all their lives who are ageing. So that's one issue. We've really got to get into it. The second one I did mention a little bit, but it is about how do we actually strengthen the community connectedness that creates a safe environment within which people live. Everyone's talking at the moment about home care, providing support to ageing people within the home. But we have to be able to do that in a safe way. Now, that's not just simply about having good safeguarding measures, which it is. It's not simply about having a better trained workforce, which it is. But it's actually about the community being part of that solution. And so I think the notions of community inclusion goes well beyond our notion of simply ensuring that people with disability live without discrimination. I think it's a much broader concept. And I think COVID has shown that to us. But the third point that I would really raise is that underpinning all of this is that the co-design of the implementation is critical, Ben. So I could go through and we could talk about 20 issues. They're all important. But if they're not co-designed with people with disability and they're not oversighted and evaluated, it won't matter what's in the document. So I go back to that broader point that whatever the people with disability want in this document, it needs to be underpinned by a very robust regime.
Thank you very much, Robert. I might go then to Karen, then Gwyneth in relation to this. Karen, what are the three things you think the next National Disability Strategy needs to focus on or achieve in the last 10 years, or in the next 10 years, rather?
So I might take your opening comment about what's coming up in the Mentimeter on attitudes and community attitudes. So this is how people are viewed in the community. We've also done extensive research on this area in Australia and comparing internationally. And we know, of course, that attitudes are vital, because if people are not respected and valued in their community, then that's the first barrier to doing anything else. Our research on that has shown that it's very important that we have government-led initiatives at 3 levels to change attitudes. Those are personal level, and that's where we see the great initiatives such as Employability Me, where people actually get to understand that, yes, we are all part of the same humanity, and diversity is valuable. The second is organisational, and this is where we see, for example, within a workplace, the responsibility of employers and co-workers to actually understand and welcome and respect their co-workers with disability. And the third is the legal structures. Australia actually has quite reasonable anti-discrimination legislation and standards. Our problem is the mechanisms for enforcing them can be quite difficult for people to access. And so I think, again, we need reform at that level.
Thank you very much for that, Karen. I do note you write You have published an excellent journal article on community attitudes, which says to look at the structural, organisational and personal levels in terms of community values for people with disability, which I must confess I rely on extensively in speeches, so I'm very grateful for that. If I might go to you then, Gwyneth, what are the 3 things you think the next National Disability Strategy needs to focus on or achieve in the next 10 years?
Okay, my first one is that children needs to focus on children and young people with disability. They're remarkably absent from the current strategy, and they're not many adults. They have their own needs, their wishes, choices and dreams. And we owe it to them to listen to them, to respect and recognise in the next strategy the particularities of their childhood and young adulthood. They and their families will be the judges of the strategy's success in fulfilling their potential. And they'll be the judges of all of us for what we offer in this next strategy. And the second, which as Robert said, is absolutely fundamental and overarching, and interestingly, where Australia does well outside our country, and that's disability inclusion. It's enforced in Australia's aid efforts in other countries to be disability inclusive, to have people with disability at the table from the get-go, but not in Australia. So my second one is that the strategy requires disability inclusive processes. It should mandate them across all aspects of society. And it does mean involve people with disability from the get-go, not consulting halfway down the track. We need their insights, their experiences, their reflections. Otherwise, how do we get fit for purpose? The third one is sort of a follow-on from that. And it's where disability inclusive has been almost totally missing from the Australian landscape. And it's something that we are all confronted with right now. It's the impact of emergencies on individuals, families, communities, the community. Emergencies produced by natural disasters, the Black Summer fires, bushfires. It's emergencies driven by pandemics. We've learned a lot of lessons, I think, and many more to learn from what didn't happen or hasn't happened in relation to preparation for people with disabilities and their families, and for the community as a whole, as Robert said, to come together to ensure everybody's safety and well-being. And we really need to engage with the emergency management sector to bring it together. It's a very good example of a mainstream sector where we need to bring it together with people with disability, the community, health, disability sectors, so that we can ensure that all Australian citizens are as safe as they possibly can be. I'd go for those 3, Ben, but of course I'd like to say I also would go for Robert's and Karen's, so I think you have to give us at least 9 or more. Thanks.
Obviously, we all like to pick as much as we can in terms of getting the next National Disability Strategy to be fit for purpose. We've only got 2 or 3 minutes left, but I thought what I might ask each of you to comment on very, very succinctly, because today's about being constructive. It's about acknowledging the good and the bad from the last strategy. What was the best thing that occurred under the previous National Disability Strategy? I might start with you, Karen, if that's all right.
I think the NDIS is a major achievement, and it's something that the world is looking to. Obviously, it's got a long way to go till it satisfies all needs and is fair and equitable. But I think we're on the path, and I think it's an example where what you've just said about being constructive, we actually need to have the opportunities for people with disability to be involved right at the top in terms of governance to make sure we get that right.
Thank you, Karen. Gwyneth, I might go to you then in terms of what you think.
Yeah, I can answer it, Ben, but I'm not sure that it's a direct link back to the strategy. I think it's a direct link in one way. I already mentioned about we've changed the discourse about disability in Australia. We wouldn't have got, I think, the Royal Commission, the Disability Royal Commission, if we hadn't had a strategy and the means by which to argue for the Royal Commission. We wouldn't have had the Productivity Commission, I believe, continuing to say, we need to do better around people with disability. Having the strategy, you know, having a document, something which is practical, you can turn to, even though there may be many people in the community who are unaware of its existence, the discourse and the conversation around people with disability has changed. Hasn't changed far enough. We need to keep driving that, but it has changed. And I don't have evidence in the sense of the direct link, but when I literally reflect on the conversations I have as a researcher in this area, families and people with disabilities, with mainstream services like emergency management, like health, start to see people no longer surprised that you want to talk about disability, no longer surprised that you say, this organisation needs to absolutely include people with disability as equal citizens, members of our community. They're not surprised. That would not have happened 10 years ago. So that has to be big strength.
Thank you, Gwyneth. And finally, if I might very briefly move to you, Robert, to answer that.
Its great strength is that it actually existed and it's seen that it's seen the test of time. The fact that Karen's consultations, the fact that most people with disability in their advocacy groups support the current framework, support the outcomes, indicates how intelligent the conversation was by governments and the disability sector. And most importantly, people with disability 10 years ago, they got it right. What happened, I think, was partly because of the good thing, that is the NDIS, it diverted attention. It diverted governments, the disability sector, money, and frankly, intelligent conversation about other needs for people with disability. But I think the good thing is that even today, it's a sound foundation to move forward, subject to all the comments Karen and Gwyneth and I have made. I think that's remarkable. And you don't see it often in social policy. You don't see it in public policy very often. So, you know, that's a great strength and a great credit to the people with disability that were engaged in that process. So actually, I think we're in a good place for the future. However, the truth is, as everyone knows, the actual outcomes have been fairly poor. And all of the measures we have, measured by the Productivity Commission on the dashboard, show we've actually gone backwards. So let's not be too rosy about this picture. We've got a long way to catch up, but I think there is a strength in the process that was and in the process that could be.
Thank you, Robert. Well, I'd like to thank Karen, Gwyneth, and Robert for their insightful contributions. They say that the average attention span in an online seminar is 8.25 seconds. So in accordance with keeping with that very rapid attention span, I'm going to move on to the next panel, but I do want to acknowledge your enormous contribution to today and disability policy more generally in Australia. Our next panel considers what is needed under the National Disability Strategy. And once again, we've produced a video relating to that, which you'll see an individual by the name of Heidi Lapalia from Women with Disabilities Australia presenting. And the question that Heidi has been asked is, what is the role of the National Disability Strategy in Australia?
Hi, my name is Heidi and I'm here as a staff member at Women with Disabilities Australia and also as a young woman with autism and chronic illness. While the role of the NDS in theory is to support the rights of all people with disability under the CRPD, it needs to do a lot more to achieve this. In particular, the NDS should have ways to tackle the widespread ableism that impedes us and segregates us from the broader community. And also should have ways to recognise how this ableism intersects with other aspects of our identities, such as our class, race, and gender. In Article 6 of the UN CRPD, the need to recognise and respond to gender is particularly emphasised, and as a young woman with disability, I can't say enough how important this is. While I've had autism all my life, when I was a child who didn't speak and didn't fit in, I didn't receive the supports, diagnoses, or accommodations that young boys with autism do. Instead, I was consistently told that I was too different, too quiet, too rude, or too rigid. An effective NDS would not only recognise the way in which these gender biases occur, but also respond to them. In order to do this, the reformed NDS should have a gender lens throughout all aspects, and it should also have specific ways to tackle the gender inequality that exists among people with disability, and to end the widespread discrimination, abuse, and violence that so many women and girls with disability experience. Thank you.
Thank you very much for that, Heidi. Those of you that may be unaware, Heidi was a youth representative at the Conference of State Parties in New York for Australia, and I'm sure that's one of many events at the United Nations she will attend representing people with disability. Well, our next panel considers what is needed under the National Disability Strategy. The present National Disability Strategy refers to the Convention on the Rights of Persons with Disabilities. The position paper also refers to the Convention on the Rights of Persons with Disabilities. And perhaps unsurprisingly, other countries or regions like New Zealand, Ireland, and the European Union have national disability strategies. A critical issue to the efficacy of the revised strategy is the extent to which non-government organisations or entities are encouraged to undertake certain conduct and the extent to which community values are picked up in the revised strategy. The speakers we have today we're very grateful to have the Honourable Senator Anne Ruston, who is the Minister for Families and Social Services, having held the position since 2019. Senator Ruston is from South Australia and has served as a Senator for South Australia since 2012. She was the Assistant Minister for Agricultural and Water Services. What is perhaps not commonly known is the important role that Senator Ruston had in the formation for the Advisory Committee for the COVID-19 response for people with disability. Whilst there has been some conjecture over the timing of the formation of the committee, what may not be appreciated by many is the persistent and much appreciated effort Senator Ruston went to in ensuring the committee was formed and the consultations she undertook during the early stages of the pandemic with people with disability and their representative organisations. Our second panellist is Rosemary Kayess, who is a Senior Research Fellow at the University of New South Wales Social Policy Research Centre and the Academic Lead Engagement of the University of New South Wales Disability Innovation Institute. Rosemary was awarded the 2019 Human Rights Medal by the Australian Human Rights Commission and was elected to the United Nations Committee on the Rights of Persons with Disability in 2018 and was appointed its Vice Chair in March 2019. It goes without saying that many people with disability owe an enormous debt of gratitude to Rosemary for her tireless advocacy over the years. And our final panellist is Paula Tesorerio, who is the Disability Rights Commissioner at the New Zealand Human Rights Commission and the Chair of the Global Alliance of National Human Rights Institutions Working Group for People with Disability. Paula is also a Paralympic gold medalist in track cycling and a dear friend of the Australian Human Rights Commission. If I could ask our panellists all to be ready for questions then and be on screen. If I might ask the first question to you then, please, Senator Ruston, and I thank you very much for being here. What is the role of a national disability strategy in Australia?
Well, thank you very much, Ben. And can I acknowledge the extraordinary work and leadership that you have afforded the disability sector, and particularly me in my 12 months as being the Minister. I can also thank Damian for his welcome to country, and I too pay my respects to Elders past present of all the lands on which we meet today, And particularly can I acknowledge the extraordinary work that our advocacy groups have done in assisting us in the development of policy going forward. Ben, sort of in response to, you know, what is the role of a national disability strategy? I mean, many of your speakers previously have outlined, you know, some of the good things and some of the bad things that occurred in the previous strategy. But to my mind, where I'd like to see the next strategy really focus is, you know, clearly the strategy provides a policy framework for us as decision makers and policy makers about how we should be developing strategy. And most importantly, to make sure that disability strategy is mainstreamed into the thinking across the whole of government. I think the idea and that we talk about disability strategy in isolation, I think is flawed. And I think we do need to make sure that our strategy is absolutely plugged in at every possible juncture into mainstream policy development. Certainly very important that we give visibility about the rights of people with disability. And I think that, you know, includes making sure that, once again, we mainstream what we do around providing that there should be no difference in the rights of somebody with disability and somebody who lives without disability. And so I think that is extremely important that we shine a light on it, because it's all well and good for us to talk about things, but unless we, you know, raise awareness and we actually get people to start thinking about some of the things that we do in terms of our discrimination, much of it is not intentional. And I think that, you know, by shining a light on some of these things, hopefully we can actually get rid of some of that unconscious bias that occurs towards people with disability. I think, you know, to provide national leadership, we really do need to make sure that we get a clearer understanding of the interface that exists between the states and territories, you know, the advocacy sector, the support services that exist within the sector. But first and foremost, we need to get a very clear understanding of what people who live every day with disability actually want. So, you know, I've always had a great view that you will only ever get good policy if you actually make the policy with the people who the policy applies to, are actually sitting in the room with you. I think one of the big challenges that we have going forward in the development of this strategy and the role that it plays is understanding the interface between the NDIS and the NDS. You know, certainly there's been a lot of focus on the NDIS of recent years, and that's absolutely excellent, and so it should be. But I think in the process of doing that, we have to understand what our next strategy is going to look like and how that actually fits in and meshes with the NDIS. Because clearly we all know that only probably around 10% of people who live with disability will actually be on an NDIS package. So what the disability strategy has to do is it has to pick up for the other 90% of Australians who aren't on a package, and making sure that their needs and are being met by more mainstream responses and policies that relate to making sure that, as I say, we have that equity argument put in place. I think, you know, the strengthening the role that the NDIS plays going forward is going to be something that we need to focus on the development of the new role. And from a federal government perspective, and Ben knows this all too well, is the focus that we need as a federal government on employment outcomes. We know that people with disability are often underrepresented in our workforce, and the impact of COVID of recent times has seen that exacerbated. So I really think that one of the things that we do need to absolutely embed in the new disability strategy is what role it can play in making sure that we are delivering good employment outcomes for people with disability. So, I mean, I think, you know, more broadly, the role of the strategy has to be to provide that overarching guidance to every single Australian, not just people with disability or people who interface with disability in their daily lives, but to every Australian, so that we can actually raise the awareness of the importance of an inclusive society, that we rid ourselves of discrimination, particularly, I think, easily that's unconscious, and acknowledge that that we have to deal with inequities in the broader population, but also inequities that exist within the disability sector itself. So, but most particularly today, thank you to everybody who's online. I hope that I can encourage you, and Ben can encourage you, and the other speakers can encourage you all to make submission to the process of the development of the next strategy. Because as I said before, the ability for us to be informed by people who the policies are actually going to impact the most will mean that we will develop a strategy that's going to be much better and much more fit for purpose than we could ever hope to without your voices around the table. So I thank you very much for your participation, and I really look forward to the feedback that we get today and the feedback that we get when you all put your submissions in as we develop the strategy going forward. So thank you, Ben.
Thank you very much, Minister, for those insightful comments. I might then move to Rosemary Kayess. Rosemary, what is the role of a national disability strategy in Australia or elsewhere? Are you there, Rosemary?
Yeah, once I unmute myself, I am. Thank you. Thanks, Ben. I would just like to echo the thoughts of the other speakers in acknowledging the traditional owners on the lands, the various lands on which we speak, and I'd like to pay my respects to their elders, past, present and emerging. I am speaking to you today from Gadigal land. I'm not going to say anything that's much different to anybody else. I'm just going to frame it slightly differently. Because from my perspective, the role of the National Disability Strategy is about unpacking the vision that we have for Australia. We've committed internationally through the ratification of the Convention on the Rights of Persons with Disabilities to an inclusive, diverse community where people with disability enjoy and can exercise all human rights and fundamental freedoms. So we have a vision of an equitable, sustainable and resilient community that respects and values people with disability. A community that recognises impairment as just one aspect of human diversity, not as something as other or different. And that impairment is inherent to human dignity. So it's a vision where we move away from the long-held deficit approach, where the rights of people with disability have been denied or diminished based on their impairment, and generally being based around issues of severity, type or diagnosis. So for me, the role of the strategy is to unpack that vision. How do we unpack that vision in such a way that we can transform Australia's law, policy and practice to achieve the vision? So CRPD provides us a roadmap on how the transformation can occur. And the NDS should be underpinned by CRPD, its principles, its standards, and identify the key measures that will be across governments and across portfolios to provide a nationally consistent plan to implement the CRPD principles and standards. And these need to be based on concrete actions and attached to specific measurable goals and targets. And that's got to operate within a robust monitoring, evaluation and accountability framework. But most of all, and this has been repeated by my colleagues, stated and repeated by my colleagues that have been speaking previously, it has to be informed by a rigorous disability inclusive research agenda and evidence base. Because if the role of the National Disability Strategy is anything, it's about Australia coming to grips with understanding that disability is just part of our humanity. And so we need to understand the experience of people with disability to be able to ensure that our vision for an inclusive society where people with disability are participating members can happen. So I'll just leave the role there and see how we go from here.
Thank you very much, Rosemary. As usual, your contribution was one that will resonate deeply with both people with a disability and those without a disability who are listening to this, and probably those who watch it later on. If I might then go to you, Paula, by contrast to Australia, there is in New Zealand a national disability strategy that was entered into in 2016 to 2026, a disability action plan that was entered into in 2019, and an independent monitoring mechanism featuring the New Zealand Human Rights Commission, an ombudsman, and civil society. Paula, what is the role, in your view, of a national disability strategy?
Thanks, Ben. I will begin by just greeting you in Te Reo Māori, the language of our Indigenous people. Inga mana, inga reo rangatimra, tēnā koutou katoa, ko Paula Tisiriro, tōku ingoa, ko Aotearoa mō te kahui, teke tangata ki Aotearoa. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. And like other speakers before me, I will also pay my respect to the traditional owners of the lands that you are currently in, into which I am beaming across the Tasman into. So, Ben, my view of a strategy is effectively viewing it as the same as that of the CRPD, which is to articulate a vision or a roadmap to progress the lives of people with disabilities, to live freely and fully as equal citizens. As such, in my view, that roadmap must be voiced and led by disabled people. It can be a real chance, I think, to model Article 4.3 of the Convention, which is about the full participation of people with disabilities in matters that affect us. Any strategy developed since the CRPD can and should serve, in my view, as a means to implement the CRPD in the unique cultural and social context of the nation that it will be in, with a particular focus on Indigenous disabled people. A strategy may primarily speak to those whose duty it is to advance those rights, but it needs to do so in the voices of communities. And I say that in its plural form because of that really important notion of intersectionality and often the multiple identities that we have. I see a strategy as something which really puts a stake in the ground about our experiences, including illustrating the disparities from which progress towards a vision can be measured. It's a way of really communicating what's important. A strategy can also be a really powerful tool for the government focal point for the CRPD in working with local and central government agencies to inform their priority work programs, their budgets and resource allocation. It can also provide a great mandate for advocates, can help agencies make good decisions informed by evidence and ensure that people with disabilities are included in all strategies, because at the end of the day, every government agency should be thinking about disability, because every policy is a disability policy. In my view, and in conclusion, it's really, really important, and this has certainly been the case in the New Zealand experience, that a strategy really needs an accompanying action plan. It needs robust data, research, and an evidence plan to sit alongside it and provide a real framework for accountability. Because ultimately, a strategy will only be worth the paper it's written on if we can actually see demonstrable progress for those we serve. So I'll leave it there until later on. Thank you, Ben.
No, thank you very much, Paula. And I might then continue with the theme of sort of the strategy more generally, I do note that we only have a little over 10 minutes before we have to move on to our next panel. But Minister, if I might kindly go to you again and then ask you a follow-up question. What are some of the biggest challenges facing a national disability strategy?
Look, thanks, Ben. I mean, certainly there are a whole heap of challenges, many of which have already been articulated by previous speakers. But I think I'd like to approach this, or my intention is to approach this more about what are the opportunities that a new strategy can deliver for us. And I think, you know, one of the big challenges is how do we design a strategy that recognises that, you know, people with disability come in, you know, many different, will have many different disabilities, which will require different responses in terms of the strategy. So our opportunity going forward to design a strategy that is not a one-size-fits-all type strategy, that we really do need to focus on, you know, the very individual needs of a very broad range of people who live in our society with disability. I mean, going back to one of the biggest challenges, I think the biggest challenge that I face as the lead on the strategy from the federal government's perspective is trying to develop a strategy that is consistently adopted by the states and territories. You know, Paula has the luxury of not having, you know, 7 states and 2 territories in which to actually manage. When you roll out your strategy, you roll it out for one country. Unfortunately, I roll out a strategy for many different jurisdictions, and that in itself, I think, presents some challenges in relation to consistency of adoption of the things that we want to do. And I think that would be one area I'd be really keen to get feedback on, about how we've seen different states and territories respond differently to date around some of the initiatives that were in the previous strategy, and how we might do a better job of making sure that we get nationally consistent responses to delivering on the wide range of things that we expect our states and territories to deliver on behalf of people living with disability. I also think, you know, the community expectation and engagement, I think, is a really big one going forward. As I said in the primary question, you know, it's all well and good to raise awareness, but we actually have to change the dial. We actually have to have outcomes achieved by this. And I think the idea that governments in and of themselves are able to make those changes by themselves, I think is flawed, and that much of this strategy does need to address greater engagement of the broader community, whether it be employers, whether it be service providers, but most importantly, the general community, about understanding how we can have a better society if everybody understands the individual needs of people, and that goes across any you know, differing levels of ability. And I think probably the final one is around translation of intention into action. I think, you know, everybody made comment about the first strategy, whilst it was great in terms of its intention, probably its implementation is what let it down. And I think, you know, to engage the people, the very broad range of people that need to enable the implementation of the intention, you know, including making sure that it's data informed and evidence based, and the communication that sits around that, I think is going to be one of the, well, it will be the great success of the next strategy if we get it right. So that would be my take home from here. But obviously, as I say, I'm here much more interested in hearing what you've got to say than what I've got to say. So thanks very much, Ben.
Thank you very much, Minister. They were particularly apt comments. I might go to Rosemary then. In relation to this issue, what do you think are some of the biggest challenges facing a national disability strategy?
Well, for me, and others have mentioned this and alluded to it, but for me, the biggest challenges is about leverage and commitment, but also having a strong cross-portfolio focus and expertise. I mean, at the moment, the current strategy has left all the heavy lifting to one department. And this fails to recognise that it's a whole of government response that's needed. I mean, people with disability are not a homogenous group. They are not defined by their disability or their diagnosis, but in a policy context, they are invisible outside the portfolio of the Department of Social Services. And that's unfair on the department and unfair to people with disability. And the COVID experience clearly exposed this and left DSS to pick up the pieces, which meant a very narrowly service-focused response because that falls within their remit. But health, housing, transport, tax, justice, tourism, infrastructure, national parks and wildlife. I mean, they all shape and have an impact on the lives of people with disability, as well as mainstream women's, Indigenous, children and youth and multicultural policy has an impact as well. So for me, the biggest challenge is to have a strong, embedded, standing engagement mechanism under Article 4.3 of the Convention, as Paula identified, for people with disability. It's recognised broadly across all types of fields that the successful implementation of anything that is the understanding of the experience of end users. I mean, it's critical. It's not so much about it being a legal obligation, though under CRPD it is, or an ideological one, but it's a really practical one. DPOs and representative organisations and advocacy groups hold critical expertise and information that needs to inform the process to ensure measures will be effective. For this, I believe we need to establish a standing mechanism that ensures people with disability have a high-level voice into the process. The other thing I think goes back to leverage, and it goes back to commitment. There needs to be strong, visible commitment, and it needs to be at the highest level. And this goes for both national and state and territories as well. So you would want to see an overarching focal point that has cross-portfolio influence and leverage. You would want to see the robust reporting being clearly public and transparent. So you'd want to see a report to Parliament every year, and that it's delivered by the Prime Minister or the Premier, that you're demonstrating that there's ownership and commitment to the vision that we've got for an inclusive community from the highest levels of our government. And so I think it's about embedding disability in all the work the government does, not just looking at our impairments and having policies around how we care, treat and protect people with disability. What we need is a government that recognises us as whole people and contributing members of our society.
Thank you, Rosemary. I might go to Paula, and I do note that we do have, unfortunately, time commitments for the next panel. But what I'll do, Paula, is I'll go to you, and then I'll finish up with the Minister by asking her a question about the Mentimeter community values queries that are coming through, and then we'll move to the next panel. So, Paula, what do you think are some of the biggest challenges facing a national disability strategy?
Thanks, Ben. I'll speak as quickly as possible and build on some of the points I think made by the previous speakers. So I think the real general challenge, but obviously it's also an opportunity, is to be thinking about how ambitious you want to have this strategy. And I would always encourage us to be really ambitious as a disability community around the type of strategy that we want to have in both countries. I think a general challenge to that, and Rosemary touched on it, is really around the engagement with people with disabilities. So we need to feel confident that a strategy will lead to change and that there'll be a way to hold people to account for that. It's all of the players involved. Some particular observations from the New Zealand experience. So our first strategy predated the CRPD. By and large, it was a okay strategy. Some would say it was pretty good, and pretty good because at the time, you know, pre-CRPD days, it really talked about disability in the social model language. And so many people looked to our strategy as a bit of a model, but it lacked some pretty important factors. So it lacked the resource to implement it effectively. It lacked a suitable monitoring framework. It lacked an action plan. It lacked governance, critically governance by people with disabilities. And the result really of that is that there was slow or intermittent progress. And we, as an independent monitoring mechanism, released our report in June this year ahead of our UN examination. Our report is called Making Disability Rights Real, and I think it really reflects actually that slow or intermittent progress against the CRPD. Of course, there's been some progress, but actually not the step changes that we would like to see. So moving ahead now to where we're at in terms of our current strategy, we're on to our second one, and the accompanying action plan supporting it was just a couple of months ago released here in New Zealand. Some really interesting things I think to note about it. One, it was very much championed at that highest level. So we have a Minister for Disability Issues, and our focal point for the CRPD in New Zealand has a very close relationship and reports through to that minister. So she really championed the development of the action plan. The action plan here, building off the strategy, was co-designed with people with disabilities. It also incorporates the principles of our Treaty of Waitangi, which is obviously an important aspect of the way that we do things. The strategy has, as I mentioned, an agreed action plan that's a living document. You know, it doesn't stand still forever. We can add things to it and build on it. And what's really important as well is that a range of organisations own the actions within it. And that brings in that, I think, that collective responsibility for delivery. It's also supported by governance, which you touched on earlier, Ben. We have an independent monitoring mechanism, which is my role, the Chief Ombudsman, and our 7 DPOs. And collectively, we monitor the CRPD. And we do that through a range of ways. But one of the things that has been really important, I think, is we meet with a large range of ministers on a quarterly basis here. And we agreed with government 6 top priorities that we wanted to see demonstrable progress on, and got that commitment from the start of this government's term. And that, I think, has focused us all really, not that all the other things don't matter, but actually there are these 6 that would make a really demonstrable difference. The strategy is also voiced in the voices of people with disabilities, and it's built around 8 key outcomes that really reflect, you know, what the world for people with disabilities would look like when each of those outcomes is achieved. So by all means, not perfect, far from it, and we have a long way to go in realising the rights of people with disabilities here. But I think that there are a number of us that do have a lot more confidence in this strategy and action plan, in the way that it was developed and some of the mechanisms around it to support its delivery and to support its accountability mechanisms. So thank you, Minister Ruston and Rosemary, for being part of this panel with you. Thanks, Ben.
Thank you very much, Paula. Minister, I might do you the courtesy of having some final remarks if you'd like. I do note in Mentimeter there is a question running about community values or attitudes. I just, if you have maybe 1 minute, anything you'd like to say, I'd be very grateful for you to add that, and then we'll move on to the next panel, which looks at specific issues under the National Disability Strategy.
Oh, look, thank you very much, Ben, and I certainly am looking very much forward to seeing what the Mentimeter has thrown up in terms of the really big issues. But I think, you know, the thing that has been so important to me here today is to get an understanding of the role of government that we can play around national leadership and the promotion of inclusion. But I suppose my final comment would be about how clearly important making sure that our National Disability Strategy has got a strong outcomes framework so that we can measure our performance and we can determine whether outcomes are really being delivered for people with disability, and none more so and more important than your work on the National Disability Data Asset to make sure that we are being clearly defining what it is that we're measuring against, because if you can't measure it, you can't manage it. So thank you so much for what you've done today. It's been an absolute pleasure to be here, and I've also enjoyed very much listening to the other speakers, which I'll continue to do so. So thanks very much, Ben.
Thank you so much for coming, Minister. It is greatly appreciated for you to attend one of the panels. If I might then move to our third panel for the day. This is issues for the new National Disability Strategy. I'm about to roll you a video for the next panel. The individual in the video's name is Brandon. He lives independently, navigates his life much as most Australians do, pays his bills, does his banking, catches public transport, listens to talkback radio, and, as he says, don't hold it against him, a Carlton supporter. We asked Brandon to answer the question, why does accessible communication and engagement with people with disability matter in the National Disability Strategy?
Communication is human right. Communication is a human right.
Brandon is proof that sometimes the most persuasive advocacy uses an economy of words. Our next panel looks at individual issues for the new National Disability Strategy. The position paper refers to the use of targeted action plans, and there is also a clear need for monitoring, and it's identified that workforce development is an especially important issue. We have 4 speakers in this panel. Unfortunately, Gemma Carey was unable to join us at the last minute, but our first panellist is Professor Anne Kavanagh, who is the co-director and lead investigator of the Centre of Research Excellence in Disability and Health and the academic director at the Melbourne Disability Institute at the University of Melbourne. Her major research focuses on the health of people with disability, and she focuses on how social determinants such as employment, housing, poverty and education influence the health of people with disability. Our next panellist is a colleague and friend, Mr. Edward Santow, the Human Rights Commissioner at the Australian Human Rights Commission, and has held that role since August 2016. Ed has carriage of the Australian Human Rights Commission Human Rights and Technology Project, for which a discussion paper was released in December 2019, and includes a proposal for the policy action to improve access to digital and other technologies for people with disability as a priority in the next National Disability Strategy. Mary Sayers is the CEO of Children and Young People with a Disability Australia, Australia's peak disability organisation for young people with disability in Australia. While it would be impossible for me to summarise the immense productive work of CIDA in a succinct way, I do note the National Disability Youth Summit 2020, which is occurring later this month, and the Education Roundtables you chair for people with disability in education. And finally, Mr. Damian Griffis is the CEO of First People's Disability Network and was the co-delegation lead of the Civil Society for Australia's second and third periodic reviews for the Committee on the Rights of Persons with Disabilities in Geneva in September 2019. If I might then turn then to Anne. And given your previous research and experience, what critical issues need to be considered in the new National Disability Strategy? And perhaps as importantly, how?
Thanks, Ben. Having come at the end of this, lots of people have said things I probably would have said. And I just wanted to reiterate that solutions don't sit in single departments. And I think, first of all, COVID, like Rosemary and others have shown, has demonstrated that that is the case, and that the fault lines between departments have seen potentially people with disabilities fall through the gaps in the response. But we've also seen that advocacy has led to change, and that, again, we are a strong community that has, through various mechanisms, influenced some policy around COVID. But I guess there's many things I'd like to emphasise. I'd like to emphasise employment as one of those. We've talked a lot about how labour force participation is low, and employment is not just a human right, but it's also a resource for health. And our work, I guess, constantly demonstrates that employment is critical for the mental health and well-being of people with disabilities. In fact, we've shown through our various quantitative work that improving employment leads to, reduces inequalities in mental health between people with and without disabilities. Yet, if people with disabilities are employed, they tend to have poorer quality jobs. They're more likely to be underemployed and want more hours. And people report from much of our work the amount of discrimination they experience in getting jobs. So just to reflect on community attitudes, which we've talked a lot about, in our community attitude survey of over 2,000 Australians, actually 20% of people agreed that employers should be able to refuse people with disabilities jobs. And 27 were actually ambivalent about it. So they weren't sure, which usually means they may actually hold more discriminatory attitudes. We also showed people had low expectations. I also would like to emphasise in terms of employment that education employment transition is critical. We still found 13% of people believe they should be people with disabilities should be exclusively educated in special schools, and that teenagers with disability are experiencing high levels of bullying in schools, which is affecting their mental health and well-being, and again, future social and economic participation. So now we have COVID, and so what are the opportunities and the perils of that for people with disabilities? I think we really need to focus on this head on in the new strategy, because otherwise most marginalised people in our community, people with disabilities, will miss out. And I think we need to move beyond simply focusing on individuals and skill development and mutual obligation. A lot of the work we've done with people using employment services shows that this focus on individuals can be demoralising when there's no jobs. So what can government do? We need to design jobs. We need to design stimulus packages now that actually create jobs for people with disabilities. Our focus should be to encourage government to think about the kinds of jobs that would enable people with disabilities to stay or become engaged in the workforce, particularly young people with disabilities who will be left behind with their disrupted education. Do we know what people with disabilities see as the opportunities in the labour market going forward? And I guess there's been a huge focus on monitoring and outcomes. And I just want to draw people's attention and the outcomes framework to the work that the extensive work the CRE has done in this regard. We, through Gwyneth's leadership, have developed a monitoring framework which was developed with people with lived experience of disabilities and is extensive and looks at all the databases around. So I urge the government to look very carefully at that and people with disabilities and the sector, because it was produced, it's careful work, and it's looked at the kinds of data we need. But coming back to the asset, which you might ask me about a bit more, but I think the disability data asset is critical here. We need to do more than just monitor outcomes. We need to actually monitor the impact of specific policies. And we can only do that by linking up data between various jurisdictions and across different portfolios, from the NDS, IS to services, DSS to health and so forth, because we need to learn whether these policies are working. What are the government job stimulus packages doing in terms of creating jobs for people with disabilities? Are people with disabilities being left behind? And we need to listen to people with disabilities in this recovery period. We need to learn from what happens, and we need to reform based on the evidence that's produced.
Thank you very much, Anne. And I also acknowledge the enormous contribution that the Centre of Research Excellence in Disability and Health does in disability research more generally in Australia, and it's something we hope continues now and into the future. I might then go to Ed. Ed, given your previous research and experience, what critical issues need to be considered in the new National Disability Strategy, and perhaps as importantly, how?
Thank you, Ben, and I'm coming to you from Gadigal land, and I pay tribute to the elders past, present and emergent here. To me, it starts with technology. Technology is central to our lives. In our recent consultation, we heard from the community, from industry, government and experts, and across the diversity of all of those stakeholders, we heard one thing again and again. Our human rights depend more and more on being able to access and use new technology, including in fundamental areas like education, government services and employment. And so if we take equality seriously as a country, all members of the Australian community should be able to access and use critical technologies regardless of their disability or other status. I'll highlight two issues in particular to answer your question. First, the next National Disability Strategy should put new technologies front and centre. Now more than ever, access to technology is an enabling right. It's a critical gateway you have to go through to enjoy a whole range of other human rights. The National Disability Strategy should reflect that. The strategy should promote better, more inclusive design of products and services that rely on new tech. And Australian governments can and should lead the way. Secondly, a national disability strategy sets out a vision, but that can't be an end in and of itself. As Paula Tesoriero said a moment ago, the strategy must be supported by positive, practical action. In other words, to make the vision real. And that informs the approach that we've taken in Part D of our Human Rights and Technology discussion paper. Some of our proposed changes are well known to many, if not all of you, and they echo those put forward by others, like improvements to the NDIS and making the NBN more affordable for people with disability. But we also propose some other changes as well, such as the development of a new disability communication technology standard under the Disability Discrimination Act. That would give clear guidance to those who develop information communication technology, as well as some of the more cutting edge communication tech like virtual and augmented reality. What a digital communication technology standard would do is it would help to ensure these products and services are designed and deployed in ways that are accessible to people with disability. In other words, living out that critical vision in the National Disability Strategy. Finally, at the risk of embarrassing him, I'd like to pay tribute to Dr. Ben Gauntlett's leadership. I've worked really closely with Ben, my colleague and friend, and he's been absolutely instrumental in this key element of our own project on human rights and tech.
Thank you very much, Ed. It's a shame your technology didn't fail at that point of your microphone, but these things happen. Yeah, I might then move to Mary. Given your previous research and experience, what critical issues need to be considered in the new National Disability Strategy, and perhaps as importantly, how?
Thanks, Ben. First, I'd like to acknowledge the traditional custodians of the land I'm meeting on in Melbourne, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past and present, and acknowledge that this was and always will be Aboriginal land and sovereignty was never ceded. When the next disability strategy ends, a baby born with disability in 2021 will be 10. A current 10-year-old student with disability will be 20, and a young person aged 15 now will be 25. Whilst 10 years for us adults might seem a short time frame, for children and young people with disability, what happens in the next 10 years will have lifelong impacts. It will impact on their friendships and peer networks, which we know are so protective, their educational outcomes, their post-school transition to further education and employment, their ability to live independently with who they want and be welcomed and involved in the community as they wish and want. Therefore, it's imperative that we get the next 10-year National Disability Strategy right. We know what needs to be done, the evidence is in, the human rights are clear, and we cannot wait. Children and young people with disability need a childhood, adolescence, and early adulthood just like everyone else. They need to have loving home environments where their families have high expectations and hopes for their future. They need to be involved in high quality early childhood education and care, have a good transition to school, and be educated alongside their non-disabled peers with high quality differentiated curriculum that all students are learning, and have the same experiences as their non-disabled peers. They need to be able to take risks, and they need to have rites of passage just like other young people. Therefore, just a few of the areas that I think the National Disability Strategy needs to include. We need a commitment from all stakeholders that the National Disability Insurance Scheme does not promote medicalised therapy and special models to try and fix children. Rather, that it provides services and supports that helps young people, children and young people have full inclusion in the community, in mainstream and educational settings and services. We need an NDIS that considers the developmental needs of children and young people, given that 56% of them, of participants in the NDIS are aged under 25, not just an adult-based scheme. The biggest influence for children and young people on their later outcomes is education. We need all states and territories and the Australian government to make a strong commitment to ensuring inclusive education as defined by the Convention on the Rights of Persons with Disability, that is high quality, not segregated from their peers, which the CPRD and the evidence tells us is so wrong. We need a national inclusive education plan, legislative reform, monitoring and accountability to prevent the discrimination that happens from low expectations, segregation, exclusion, gatekeeping and restrictive practices. We need better data to monitor how our current mainstream and disability-specific services are improving outcomes for children and young people. But most importantly, we need the National Disability Strategy to facilitate children and young people with disabilities' voice. As Ben mentioned, next week we're holding a National Youth Disability Summit. We are hosting over 200 young people with disability who have registered to attend. It has been completely designed, owned and delivered by young people with disability. And 4 of these 5 days, the adults have to get out. It's only young people with disability. Young people know what they need in their lives, how systems need to change, and they must be involved in co-design and co-creation. I'll have a few more points in the general discussion, but I just wanted to re-emphasise how crucial this next 10-year NDS is. We can't afford to wait.
Thank you very much, Mary. Damian, if I might then go to you, how would you answer the question I've posed to the other panel?
Thanks, Ben. It's difficult to think of any more disadvantaged Australians than First Nations people with disability. This is because they often face multiple barriers to their meaningful participation within their own communities and the wider community. First Nations people with disability experience discrimination based upon their indigeneity and/or disability. We need to recognise that many First Nations people with disability live in poverty. Sometimes what we see is the denial of the most fundamental of human rights and human needs. That is access to shelter, access to food, and access to health. To address these critical issues, we need innovation. We need to protect and promote community-based solutions that put First Nations communities at the heart of decision-making. And we need long-term partnerships between communities, government and NGOs, not short-term project-based thinking. None of these issues are insurmountable, especially if we apply the same commitment and mobilisation that we have seen in addressing COVID-19 in Indigenous communities, which has been extraordinarily successful to date. First Nations people with disability must be more than a paragraph in the NDS preamble. We must have our own strategy within the NDS strategy. Meeting the needs of First Nations people with disabilities is one of the most critical social justice issues in Australia today. As a nation, we should be measured by how well we meet the needs of some of our most vulnerable people. The NDS must be a heart-based document, not an audit. It must be about how, as a nation, we truly and meaningfully and innovatively realise the human rights of First Nations people with disability and all Australians with disability. Thanks, Ben.
Thank you very much, Damian. And I know we've only got 10 minutes left for this panel, so I'm going to have to ask you to be relatively succinct in your answer to the next question. But and if I might put it to you then, on the Mentimeter, and the code for Mentimeter for people who may have forgotten is 4104984. The final question is, how can we work together to ensure the strategy is understood and followed across all sectors, government, non-government, and the community? What's your view on this?
I'm sorry, I think I'll just repeat back the question because I'm not quite sure I heard it. That we need to work together, government, non-government, and what was the other part of it?
How can we work together to ensure the strategy is understood and followed across all sectors, government, non-government, and the community?
I mean, this is absolutely critical. I think the strategy is not going to work unless we do achieve that. And I think we've demonstrated that. Again, I'd like to bring us back to the example of COVID-19, because I think this draws attention to the fact that people with disabilities, those of us experiencing day-to-day issues with how government works, with how to have our concerns heard, are the people that have the knowledge on how to solve these problems. But we also need to measure those outcomes, and we need to hold government accountable. So I think there's a lot of innovation out there in the sector. There's a lot of ideas. We need to harness those ideas. We need to work with government, come up with practical solutions, and we need to learn and reform based on what we learn from our ongoing monitoring and evaluation and of what we do. I just also wanted to put a bit of hope there. I think the National Disability Data Asset shows the government's commitment and potential to do that differently through linking up and making available for transparency and accountability data on what's been happening. I think the other commitment from the Department of Social Services to the National Disability Research Partnership is yet another indication that we may see quite a lot of differences moving forward in terms of research that's able to shed more light on how we can best move forward to improve the lives of people with disabilities. And so I hold some hope for the future in those initiatives. The National Disability Strategy is one mechanism. Those are other mechanisms that work alongside of that.
Thank you very much, Anne. Ed, how can we work together to ensure the strategy is understood and followed across all sectors, government, non-government, and the community? And in particular, the question I'd like to ask you relating to technology is, how much do we need laws to say this, or can we rely upon guiding principles?
Maybe I'll start by saying what is attractive, but we know doesn't work. It doesn't work just to put out a really appealing vision and then just hope that everybody is going to be kind of mesmerized by it and that it will galvanize really significant action. We're not putting out a feature film here. What we're trying to do is actually change people's behavior. And we know that the only thing, I mean, we've got literally hundreds of years of experience here. We know that the only thing that tends to work is the tried and true, and that is carrot and stick. So governments can, through the mechanisms that support the national strategy, they can provide incentives that will make it more appealing for people to, in the case of technology, to design and implement new technologies in ways that are truly inclusive. They can do that through their procurement and a range of other mechanisms. But ultimately, to answer your question, there has to be a backstop, and the backstop is the law. That's the stick. There've got to be minimum standards that we know are going to be enforced, because a human right that is not enforced isn't a right at all. It's just a good idea. That was something that Frank Brennan really emphasised in his National Human Rights Consultation Report, and it's something that I think is vitally important always to remember.
Thank you, Ed. Mary, how would you answer that question?
The way I would answer that, Ben, is around respecting all parts that the different stakeholders play. And I guess disability advocacy organisations play a critical role in amplifying the voice of their members. And so we need to make sure that disability advocacy organisations are seen as part of the solution and working in partnership with government to actually achieve the outcomes. But that cannot be done without genuine co-design that involves actually people with disability. And from the lens that we sit is children and young people with disability. They need to be involved from the start. For example, as I mentioned, 56% of NDIS participants are aged under 25, yet we have no formalised consultative structure to include them in the policy work and the policy development for the NDIS. We know across a whole range of policy areas, voice is lost. So, excuse me. So I think recognising that we all have a role to play, and that is a really important, and the National Disability Strategy to galvanise. I will absolutely agree with Edward. We need carrots and sticks. In the children's space, there is so much legislative reform. We don't have independent oversight for protecting children and young people from abuse in this country. There's a whole range of reform that needs to happen. So that's probably enough from me.
Thank you very much, Mary. And Damian, I might throw to you to finish off for everyone before I conclude the event by asking Hannah from Centre for Research Excellence and Disability Health to make some concluding remarks. Damian?
Thanks, Ben. I agree with all my fellow panellists, but something we've been advocating for a long time now at the First Peoples Disability Network is a mechanism that could perhaps look similar to the Closing the Gap structure that exists at the moment. Closing the Gap is far from perfect, but what it does do is for at least one day a year, the Prime Minister is required to report to Parliament about the situation for Aboriginal and Torres Strait Islander people in Australia today. we have long thought and wondered why there isn't a similar approach that focuses on the situation for Australians with disability. And the National Disability Strategy could inform and come up with the measurements to do that. And in fact, in some ways, disability is more advantaged than the Aboriginal and Torres Strait Islander experience, in the sense that there are a number of mechanisms that could be used already to determine the experience for young children with disability in education, the employment experience, the transport experience, the housing experience. So we think that idea has value, and that could be one way of having some high profile mechanism to review the situation annually, perhaps even more regularly than that. But thanks.
Thank you very much, Damian. Unfortunately, one of the challenges of the online world is the need to move between participants quickly and get rapid answers. I'm sure we could all speak about these issues indefinitely, in particular the issue of how we enforce and make sure that the National Disability Strategy is fit for purpose, the importance of data and enforcement. But I might ask Hannah Badland from RMIT University and a member of the Centre for Research Excellence in Disability and Health to give her perspective on today's proceedings.
Great. Thank you, Ben, and thank you to the previous speakers. So I respectfully recognise the sovereign relationship and acknowledge the traditional custodians of country and their elders past, present and future on whose unceded lands we conduct our business. Today I'm speaking on Woiwurrung and Boorwurrung lands of the Eastern Kulin Nation, and I uphold the Indigenous notion that if we care for country, it will care for us. So thank you to the Australian Human Rights Commission and the Centre of Research Excellence in Disability and Health for organising this really thought-provoking panel session. And thank you also to the panellists for sharing your expertise and thoughts. Special thanks must go to Senator Ruston for her ongoing active contributions in this space and including her participation today. So the next strategy is a critical opportunity to shaping realistic policy approaches that can better optimise outcomes for people with disability. It has the potential to strengthen the measuring and monitoring of disability-related outcomes, and importantly, this has been said a lot by the panellists today, link across sectors and portfolios. Embedding an outcomes framework, which is regularly reported on, again, something that's been mentioned several times, it will enable us to better understand trajectories over time, inequities, and also identify the range of policy levers to improve the outcomes of people with disability. And as Ruston said, what gets measured gets done. So adopting an agile approach may become more important in future, also given the legacy of the COVID policy responses that we're yet to learn how they may shake down. So there's also an opportunity for the strategy to link in with existing tools and resources. And as Kavanagh mentioned, the Centre for Research Excellence in Disability and Health has produced the Disability and Wellbeing Monitoring Framework and Indicators. It's been developed in consultation with people with lived experience of disability. It also includes person and area level indicators that can be actioned across Australia, and the indicators have been mapped to the CRPD and the ICF. So to conclude, and as many of the speakers have identified today, the success of the next National Disability Strategy lies in the importance of an underlying framework and incorporating the lived experience for a diverse range of people with disability, for formulating a broad range of policies, including the delivery of systems that safeguard. The panellists have recognised the benefits of building on the good efforts already achieved through the previous strategy, but more needs to be done in a timely way. So thank you for your time, thank you for this opportunity, and please make your voice heard. The submissions on the position paper close on the 30th of September. Thank you.
Thank you very much, Hannah. I too would like to acknowledge the tremendous assistance that the Centre of Research Excellence in Disability and Health in organising today's program, and also their assistance more generally to the Australian Human Rights Commission in ensuring that we have good disability policy that is good for all Australians. In organising today, I'd also like to acknowledge the work of the Social Deck, who are a delight to deal with, and have dealt with innumerable tech issues, and I'd like to also acknowledge the interpreters for their role today. A copy of today's event will be available on YouTube at a later date, but most importantly, what we want and we need is for people, all people, to engage with the National Disability Strategy and the position paper that has been released, and ask whether these policies and procedures are fit for purpose. The ultimate role of the Australian Human Rights Commission is to shine the brightest light into the darkest places. Almost 1 year ago to the day, the CRPD committee released its concluding observations relating to Australia. Some of those observations people would think relate to everyone, like housing, the need for mandatory housing standards with universal design principles. But others relating to issues such as forced sterilisation, being recognised as equal before the law, or indefinite detention on the basis of mental health or cognitive disability are concerns which Australia can and should and does need to deal with. Good policy means that we do not have as many dark places to have egregious circumstances arise. We need to get the policy right to ensure that people with disability can live the lives of their choosing. To do so, the mantra "nothing about us without us" needs to be respected, now and in the future, and at all levels of decision making. Thank you again for attending. Please participate in the process, and I wish you a good day. Thank you.